Welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today is Margie Propp. And thank you, Margie, as always. And thanks to everyone for joining us. Our local situation remains on the right track with all the key indicators showing improvement this week. This week, the Wriststyle is moving from mid-yellow to low yellow. The Wriststyle has not been in green since last July, and our collective efforts are getting us closer to reaching that lowest level on the dial. Over the past week, the number of new cases continued to decline. As the chart shows, the number of new cases has declined at 40% each week from the end of January through the beginning of March. And finally, we're seeing the positivity rate also show significant improvement. This past week, ending March 5th, the rate dropped to 4.6. This is the first time the rate has been below the 5% threshold since the week ending on July 17th of 2021. We're also very pleased to see the number of COVID-19 patients hospitalized locally continue to decrease. As you can see on this chart, the decline in the 7-day rolling average of COVID-19 hospitalizations is going down to below 50 at the beginning of March. Today, the hospitals are reporting 41 patients, 29 from Lancaster County. We have no new deaths to report today, and we've lost one member of our community to COVID-19 so far in March. Sadly, deaths are a hard reality and a definable outcome of this pandemic. Tracking them throughout the pandemic continues to give us a better understanding of the impact of the virus in our community. We made some enhancements to the dashboard to provide additional detail on the COVID-19 deaths. And joining us again today is Tommy George, one of our public health epidemiologists, who will go over some of the updates. Tommy?
Thank you, Director Lopez. I'll be reviewing the changes we've made to our COVID-19 dashboard to provide more detail on deaths due to COVID-19 in Lancaster County. These are individuals who are cases in Lancaster County and whose death certificate shows they died of COVID-19. The additional information I'll review today helps to highlight the different risk experienced by vaccination status, age, and other demographics. First, our summary tab on the deaths page shows the number of deaths per month in a bar chart. This chart shows the number of deaths due to COVID-19 with the date of death in that given month. For example, in December, 39 individuals died of COVID-19. Second, we've incorporated more information on deaths by vaccination status and by age group. The slide shown now has the same information as the summary tab, but shows the number of individuals who are unvaccinated, partially vaccinated, fully vaccinated, or boosted. This chart highlights that most individuals who died due to COVID-19 are unvaccinated. This slide shows deaths by month and by age group. The age groups used in this chart are those 30 years and younger, 31 to 49 years, 50 to 64 years, and 65 years and above. This age group chart highlights the increased risk to individuals with increased age. A familiar page would be this demographics tab that's on the slide now. No changes have been made to this page, but here you can see an overall reflection of deaths by sex, race, and ethnicity, and more age groups. That is the rundown of our latest dashboard enhancements. I'm going to turn the podium back over to Director Lopez. Thank you.
Thank you for that information, Tommy, and thanks to the entire epidemiology team along with City Information Services for their continued work on the dashboard. Our COVID-19 dashboard can be found at covid19.lincoln.ne.gov. Now turning to the Wriststyle, as I mentioned earlier, with every key indicator improving, the position has now dropped to low yellow. This indicates a moderate risk of spread and impact to our community. No indicators are currently in the red or orange categories. 3 indicators are in yellow: case rate, hospitalization, and deaths. while the other key indicators are in green: vaccination rate, testing turnaround, and now positivity rate. The position of the Wriststyle can be seen in low yellow on this color-coded gradient map represented by the blue square outlined in red. Our local public health guidance for yellow can be found at covid19.lincoln.ne.gov. In moving on to COVID-19 vaccinations today, staying up to date on COVID-19 vaccines includes getting a booster dose when eligible. This helps you maintain a high level of protection against the virus and helps to keep COVID-19 at a more manageable level in the community. More than 66% of all Lancaster County residents are fully vaccinated, and 60% of the residents aged 12 and up have now received a booster or third dose. And now let's look at our vaccine clinics at local elementary schools through March. Later this afternoon from 4 to 6:30, we'll be at Arnold Elementary School. Thursday, March 10th, we have a clinic at Clinton Elementary School from 3:15 to 6. And then next week we have no clinics at the schools, but again on Tuesday, March 22nd, we'll be at Elliott Elementary from 3:15 to 6. And Thursday, March 24th, you will find us at McPhee Elementary from 4 to 6:30. And Tuesday, March 29th, we'll have a clinic at Prescott Elementary from 2:45 to 6. And on Thursday, March 31st, we'll be at Freestrom Elementary from 3:15 to 6. We also have clinics at the Health Department every week. You can find more clinic times and our locations on our website or by simply calling us at 402-441-4200. I also want to provide an update on testing today. With our local situation getting better, the demand for testing has dropped at our site that we have had in partnership with Total Wellness at 19th and O Street. The site will be closing for the time being at the end of this week. And a reminder to you all that we have at-home tests available at the Health Department in the main lobby during business hours. We're located at 3131 O Street. Just walk in and pick one up. Currently, more than 5,400 test kits have been distributed in our community. And in closing, our community continues to move in a positive direction with all key indicators showing improvement. To that point, we won't be holding a briefing next week, but we'll still release an update on Tuesday. The next briefing will be the following Tuesday, March 22nd. And with that, I'll take any questions.
It's Matt Olberty with Telephone. Hi, I just had a question on sort of the updated death numbers that you guys have now on the city COVID-19 site. One of the things that struck me is that there seemed to be proportionately a lot more deaths among younger people this past fall than there were earlier in the pandemic. And I was just curious as to whether is that likely because of Delta, the Delta variant?
Yeah, it is Delta.
And then in terms of the significant numbers of vaccinated and boosted people that died, especially in the last, toward the end of 2021, are those mostly or almost exclusively older people with or people with serious health complications?
Primarily, the older individuals that passed away that were vaccinated or boosted did have some type of serious underlying condition, as well as if you saw some of those younger ones that were vaccinated and boosted, they tend to all have some type of underlying condition.
Okay, thanks.
Okay, thank you again for joining. Oh.
Sorry, Pat, it's Matt Olberty. I just had I had one more question for you. My understanding is that LPS is going to, the board tonight is going to end its public health emergency, or its emergency status that allowed the superintendent to move, unilaterally to deal with the pandemic without board approval. Do you guys have any idea? I mean, if we move into green, will there be any sort of movement on local conditions in terms of public health emergency ending?
I think it's too early to say anything about that. If you remember, we've been in green before. And I think we just probably need a little bit of time to see where we're at as a community and as we go forward. And sometimes there are different reasons to keep an emergency status in place related to how we can respond and what funding opportunities we have available, Matt. But that's something, obviously, that's always being evaluated. But the emergency declaration comes from the mayor to the city council and the county board.
Okay, great. Thank you.
Okay, thanks again for joining us today. Remember to get vaccinated and get your booster.